Charles. We're so glad you decided to come back and chat with us. We had such a great conversation with you last time. The last time we spoke, there was not snow on the ground. It was nice and warm out, and we were actually getting ready for open enrollment. And we had lots of projections and thoughts and where we were going to be. And like I mentioned to you, it was quite apropos. Just yesterday, I think you published a blog with the numbers. So we are so glad you're here today to talk to us a little bit about what happened over open enrollment. So if you want to just take a couple of seconds and reintroduce yourself for anybody who's listening for the first time, why don't you do that? And then we'll dive right into the ACA numbers.
Sure, and thanks for having me on again. Yeah, so for those who may not know who I am, I was a website developer, freelance for years, and then back in late 2013, when the ramp up for the first open enrollment period was getting going, and of course, the federal exchange healthcare.gov was having all sorts of technical problems, and along with some of the state exchanges. I basically just started as a sort of a hobby. I started doing live tracking or crowdsourced tracking of ACA enrollment numbers. And it was just supposed to be a hobby. And one thing led to another. And next thing I knew, well, it's like 9 years later now, and this is what I'm doing. Over the years, I expanded. I learned a lot about health insurance, the healthcare industry, Medicare, Medicaid, individual market, the group market, all that. And I started a blog. And so I've done a lot of healthcare policy data analysis, advocacy, and education. But the core of all of this is still the ACA. And so open enrollment is like my, that is my Super Bowl of what I do. So yeah, so the report that came out yesterday morning from the Centers for Medicare and Medicaid was perfectly timed for this podcast because they updated all sorts of numbers. And I guess that's what we're going to be talking about today.
So I'm thinking one of the questions at a social gathering that people will ask is, tell me something I don't know about you. And you get to say, my hobby is tracking the ACA. And either everybody gathers around or everybody goes to the next room, right? Depending upon what the gathering is.
Yeah, pretty much. That's, I mean, God knows my wife and son are sick of hearing about it. So they could not possibly care less. Like, well, they're happy for me that I'm really excited about this stuff.
Right.
Really
well, good. So we're glad to have you because we really do want to hear it. We really do want to talk about it. One of the things we talked about the last time you were on, and it was on everybody's mind, is we had that whole extended SEP through August of 2021. So we really just had 2 or 3 months of no real active enrollment. And people were wondering what was going to happen to the numbers if we had such an elongated SEP, special enrollment period at the beginning of the year, and we had the American Rescue Plan, which increased the subsidies. So, I mean, I don't know if you can think all the way back, but kind of what were the projections for open enrollment? And then now that we are just 4 days away as of recording from the end of open enrollment, how did we meet those projections or miss or exceed?
Yeah, well, I always knew that, or I always suspected that total enrollment for this open enrollment period would be yes. Simply because, between the expanded subsidies and the extra time people had over the summer during the special enrollment, it was just a question of how. And there were some other changes made as well, including the federal navigator program was actually refunded and things like that. So it was just a question of how much higher. And so at the time, I don't remember if I made like a hard projection or anything at the time, but shortly, like just before the open enrollment period did start on November 1st, I said, well, it might beat it by like 1 million people because it was 12 million on the nose or almost on the nose last year. The all-time high for open enrollment was back in 2016, which was 0.7 million nationally. And so I figured, okay, we'll probably be it. And so I came in at like 13 million. And I figured if we anything over 13 million, is gravy, essentially, is be a nice bonus. As it turns out, where the numbers that they released, they had a big report just before like right after the December 15th deadline, and it blew that away. It had already blown that away. It was around 6 million at that time nationally, and then yesterday they issued an updated report, which bumped it up another couple 100,000. So officially, it's around 13.8 million. The thing to keep in mind is the through dates on that. What was kind of unusual is that they updated the state-based exchange numbers, because in the previous report, the federal exchange numbers were as of December 15th, as of the December deadline.
Right.
But the state-based exchange numbers, those were only up through November 27th. So they were about 3 weeks behind. Yesterday's report, I was expecting them to update the federal exchange numbers, and instead, but they didn't. Those numbers through yesterday are as of yesterday are still only through December 15th. So there's almost a full month. Basically, they have not updated the numbers for anything for the federal exchange states. With that extra 200,000, that all came from the state exchanges, which they bumped up through Christmas Day, through December 25th. So
right.
So they tacked on another 4 weeks of those. So there's still, when the dust settles, there's still going to be like a full month of enrollment for exchange states. I'm sorry, for the federal exchange states, and then plus about three weeks or so for the state exchange states. So it could still go up more. I'm certain to break 14 million. I suspect it'll probably come in somewhere around 14.5, something like that, by the end of January. It's important for people to remember that the deadline is the Saturday, the 15th in most states, but there are a few states like California and New York that have an extra couple of weeks through the end of January. It's conceivable that it could break 15 million. I would say somewhere between 14.5 or a little over that maybe would be my. If it breaks 15 million, that's great. But that would be like my hard ceiling.
Yeah. Well, and then I just got notification today that there's a potential proposed rule in Colorado for a special SEP due to the wildfires. So that may extend some of those dates there. I don't know how much it's going to swing the numbers, but we're kind of getting to the end of it. But we've got some pretty big numbers that I think people are excited to see.
Yeah.
So, yeah.
Oh no, I was just saying the other. Speaking of big numbers, the other number that I want to give special mention to is, depending on how you define it, it's actually about 1 million more than that, because the basic health plan program in New York and Minnesota, those enrollees, I think, should be counted as part of that top line number. They never are. They're always given like sort of an asterisk or a footnote, but and I've never understood that, because between the two, it's over 1 million people, and that's a lot of, and those are all who would have been, or the vast bulk of them anyway, would otherwise have been enrolling in ACA exchange plans. So the fact that they're part of a separate risk pool or whatever, that's all aerial behind the scenes stuff,
right?
But I think they should count.
So kind of ironically, Constance is in Minnesota. I'm in New York. I just want to ask you, Constance, like, when you talk to people there, do they differentiate between whether they're getting a QHP or a BHP? Do they even know the difference?
Oh, no. There's sort of two routes. There's maybe three. There's one is, do you know anybody who can help me, right? And that's a small individual broker or agent. The second would be just going online to go health insurance, right? 2022. And then the third is probably something, if they're aware of MNsure, that's probably the fourth. But the third is probably, I guess it's Blue Cross and Medicaid and Health Partners. And
right.
There are some other people here, but those are the ones that have their brands on billboard. So, it is totally non-strategic about who they're getting it from, how they're getting it, what those subsidies mean. I think maybe there's a small percentage of people who are educated on the tax credit and the subsidy, and maybe they've been in SNAP and CHIP programs and other Medicaid oriented programs. But the majority of people are just, what do I do? Or, you're auto re-enrolled, quite honestly.
Right.
I mean, a huge part of I would guess every state and federal exchange is that you're just auto renewed because of COVID and because of if your income hasn't changed and they haven't found anything in the IRS or the state income, you just get auto enrolled, auto re-enrolled.
We just did an analysis of the clients that we have, and it's over 70% just do auto re-enrollment, so they don't even have to think about it, which I get. And just back to the BHP thing for 1 second, because it's I live and breathe this every single day, and that's just not a factor that I know anybody is looking at it. So I get it, they want to carve it out, but I do agree with you, Charles. It's when we're doing the numbers, I think we look at the numbers holistically, and then we've got a much larger number.
I think the other thing, Sarah, about the way that healthcare is organized for the most part, if you're an actuary and underwriter in the background, you kind of understand that it's a net zero sum game, right? If you sign up for a high deductible, plan with high copay or whatever the metrics are that are making up that plan, you're either focused on paying higher premiums or paying higher deductibles, right? Or out of pocket. So there's sort of a net sum game for the majority of health plans that people have decisions around. Where it skews on one end of the bell curve or another is I have like very little healthcare needs and therefore I'm way over here, or I have a lot of healthcare needs and therefore I'm going to be high cost no matter what, right? So I think that the impetus to get educated on these plans and on these opportunities, not only is it complicated, but it's a net zero sum game for most people.
Yeah. So then, Charles, when we look at it kind of state by state, whether FFM or a state exchange, our two biggest players, not surprising, Florida and Texas, I think they always are. Are there any states that were surprising this year, either with higher than expected enrollments or lower than expected enrollments?
Yeah, I mean, and of course, this is updated a little bit because of the report that came out yesterday, although again, that only updated the state exchanges. So,
right.
Don't know where the federal numbers are, but yeah, overall, as you noted, the big story, of course, is Florida and Texas, but not just because they're states, but also, of course, because they have not expanded Medicaid, and so as a result, you have this massive chunk of people below the 138%, poverty line income level, who the American Rescue Plan sort of halfway dealt with the Medicaid gap, not the gap itself, but with the Medicaid population by essentially turning off that population zero premium, what I call it secret platinum plans. They're the CSR silver, but nobody knows what CSR 94 means.
Right.
So I just call it secret platinum. It says silver, but it's actually platinum. Or at least I've been trying to do that. And so yeah, there's of the states which did not expand Medicaid, enrollment this year is up over 1.3 million people versus last year, and 900,000 of that is in Florida and Texas alone.
Wow.
So that's just a huge increase.
Follow the percentage of people being infected or being seriously ill because of the COVID virus or Omicron. I mean, do states are like, wow, healthcare is now necessary because my neighbors and my family are at risk, and I need to do something about that?
Yeah, I mean, I'm sure that's part of it. And that's also, that also gets into, and I think this is something that we did talk about last time with the special enrollment period, which is the irony of the reason, the only reason why there's a limited time window for first place is because, the insurance carriers insisted on it to avoid, adverse selection and for people gaming the system and, healthy people waiting until they got diagnosed and then trying to sign up then and all that. And they were fighting tooth and nail to crack down on SEPs and, make sure you verify that they really, move or have a baby or whatever. And last year, 2 years, when the first wave, they were AHIP and the Blue Cross Association. They were actually sent an open letter begging them to reopen enrollment at the time. And it was like, well, you're the guys who said that we could, And of course, the reason is like basically what you just said. The pandemic, it's a whole different ballgame. Post-election, still a thing, but it's not. I don't think these days. I don't think there really are that many people who are doing it anyway or inclined to do it. But if there were, I don't think they have been for the last 2 years. Because basically you've gone from playing Russian roulette with one bullet in the chamber to like 4. So the odds have gotten much more higher. The stakes have gotten much higher, and so I think a lot more people are have jumped in.
And the other thing to add to that would be the fact that employers dropped employees,
Sure.
right? They had to shut down. They could no longer offer insurance. Maybe they offered part-time hours and no insurance. So I think you also have, and it'll be interesting to see where this does break down, because, the job market is iffy because people couldn't stay in their positions. And now when they're looking again, I think benefits are one of the things that are most appealing to them when they look at what their next job will, besides, being able to have more flexible schedules and maybe, remote working. I would think benefits would be high on the list, given that I've lost my full employer.
Well, I think the flip side to that is the great resignation, which we've heard about a lot, right? After COVID, there's a lot of people who aren't going back unless it meets, all of these needs. It has to be remote. It has to be this, which really is increasing the gig economy, which likely doesn't have group benefits, which means you may be eligible for ACA. So you're seeing all of these different factors come together for a perfect storm, which is why we see our 14.9 million number when you look at everything all said and done.
Well, that's an interesting when you think of payers have to then adjust to that. I mean, in 2010, when ACA came out, payers were worried about adverse selection. Like, I haven't heard that term since COVID. I have not heard anything about adverse selection or how I'm going to brand to consumerism so I don't get the unhealthy population. I get that young invincibles. But I don't think that that's even part of the conversation right now. It's more about how do we, have a spread of plans that meet these, new dynamics that we're trying to deal with in the market and unknown dynamics going forward.
Yeah, as you said, it's a combination of all these things and more. But yeah, what it's really done is it's forced people to completely rethink, what do you want, how many people have been in jobs where they hated the jobs, but the only reason they stuck around in a lot of cases, it wasn't so much the salary itself, although of course that's, the income is part of it. But in a lot of cases, it was because, but it has the pay sucks, but it has or the hours suck, but it has a decent healthcare plan.
Right.
Well, but now they're realizing, now they're out kicked to the curb. And of course, you just lost your healthcare coverage at the exact point that you also lost your income, and in the middle of a pandemic. So it's I would think, well, they'll all just be hired off again, but I think to some extent that might be happening. But I think overall, there's a lot of people are going to be like, well, you know what? Now that I've already lost the job, I've already lost the coverage, and now I'm covered through an ACA plan. Now that I have this ACA plan, well, I do need to get my income back, but maybe I'm going to do something that doesn't, go elsewhere,
right,
and find a different job or something. And again, you have that whole job lock thing where you're no longer absolutely tied to this particular job for these particular benefits, and of course tied into with again the American Rescue Plan. And for a lot of people, this gets into the Build Back Better bill, and are they going to pass? Are they going to extend those enhanced subsidies? And if they do, great. And if they don't, next year is not going to be pretty, because a lot of those folks, especially if they were not eligible for the subsidies before the American Rescue Plan, they're going to be in for a very rude awakening this November. Sorry, if they do not extend those subsidies. So
let's switch a little bit. We had quite a few states move to state-based exchange this year. How did those states perform compared to previous years?
Yeah, there were three states this year, small states for the most part. You've got Maine, which looks like they're currently up around 9% last year, so that's pretty good. New Mexico is about dead even. They're up just like less than 1%. They're basically even year over year. And then you've got Kentucky, which is the very unusual case because they had their own very successful exchange for several years, which was then shut down for no particular reason. So they moved to the federal exchange and then they moved back to their own exchange. And so far, according to the numbers put out yesterday, they're actually not doing so great relative to last year. They're down about 7 now. Having said that, again, these other factors we've talked about, it's possible that if more people lost their jobs and are, maybe I'd have to compare that to like their Medicaid expansion numbers.
Right.
It's possible that there's a chunk of, again, with Kentucky, you're talking a difference between like 78,000 last year to 72,000, it's like 6,000 difference. It's a small number. If 10,000 more, of those people went from not being on exchange plans to moving over to Medicaid because of their income drop, then that might explain it. So it's hard to say. It's going to vary by state, though. How it impacts people. But yeah, so those three states have for overall they're doing. It's nothing extraordinarily well or poor, but they're in there.
Yeah.
The state right now that's doing the worst relative to last year, and when I say worst, that's in terms of exchange enrollment. Again,
right.
Would actually ironically be Massachusetts. They're down about 11% in overall enrollment this year versus last. But again, there could be any number of local economic, reasons for that. So we'll see.
Right. Yeah, I mean, it's very interesting to see how the numbers are fluctuating. And when you're comparing this year to last year, are you comparing this OE to last OE or this OE to everything through August 15th of last year?
I am comparing. Oh, and that is an important point. I am comparing this OE versus the end of last open enrollment. So,
got it.
So when I mentioned that Massachusetts is down 11%, that's versus the end of last year's, whereas, so that's not including the month or so that we're in the middle of right now.
Right.
So it's possible they could end up, running even or even slightly ahead. I up until now, I against the same point in time for each week, but we're so close to the end now that it seemed a little silly to worry about that. So, but what you did mention about the period, that's relevant, especially when it comes to comparing renewals versus new enrollees, because of how those are defined.
Right.
When you look at the numbers this year, new enrollment is up. Let's see, nationally, they don't have the state numbers yet, but nationally, new enrollment is down substantially when compared to last year's new enrollment. It's down like 14% on the federal exchange, a whopping 37% on the state exchanges, and that sounds very bad, except that renewals are way up. They're up like 27% and 19% versus last year. And the main reason for that is because you had 2.1 million people who enrolled during that spring, summer special enrollment period who are technically renewing. They may have renewed, or they may have been new on August 15th, but for purposes of this OE,
right, they're now considered a renewal.
They're considered renewals. So
right.
It's a definition thing. It's just a question of which bucket you're considering them to be part of. I don't know that it necessarily. There's some analysts who are like really concerned about whether new versus renewal. For me, an enrollee is enrollee. If they're enrolled, that's
right.
Great.
So do you see anything? I mean, with these numbers, what decisions are people making? Not consumers, enrollees, but plans, payers. The industry around policies, states. Does this inform them of maybe some agenda they already have? or will create based on this?
Well, I know one of the things right now is is on networks, because I know, like, I think is it Centene, I think. Maybe I'm mixing it up with someone else. I don't want to name the wrong name here, but I know that there's a couple of carriers that basically been gobbling up market share and the last couple of years. In a large part, they've been doing it so by sort of by undercutting the competition, which sounds great, except when you look at how they're doing so, and if they're doing so with really works, providers and such, then that's not such a great thing. And the irony is, for years, one of the complaints about the ACA was people worried about bare counties, and because there were a couple of years there where, like, United Healthcare and Aetna, Humana, where they all just pulled out of dozens of states all in one shot. And there were, stories about, like, in Arizona, where, oh my God, there's like half the state of anyone, and or it's going to be monopoly, only one carrier available anywhere, and they have total control. Well, the irony is we kind of have the opposite problem now, which is that everybody's jumping into the market this year. There's more carriers than ever. There's more choice, more plans, more options, which again sounds great, except that, number one, it confuses the hell out of the enrollee.
Yeah.
If you don't have a good broker or navigator to help you out, and you're not, I mean, there's been stories from, like, healthcare writers and insurance, analysts who they themselves get confused and do for my own family, and who have trouble figuring some of it out. So it can be very, very confusing. And the other problem with that is that you get into things like what my colleague David Anderson always called silver spamming, which is where a carrier will just carpet the exchange with, like, 20 different virtually identical plans with slightly different names, but because they're all they're trying to basically monopolize that benchmark.
Yeah.
And not only is that confusing as hell for the enrollee, but it also, it has a way of manipulating the benchmark plan, which means that the subsidy formula gets kind of wonky. And as you mentioned before, there are millions of people who just auto renew. I tell people every year, do not auto renew. It's not necessarily a bad thing, but even if you do renew with the same plan, do so actively. At the very least, log back in, take a look, and see whether there's a better option, because people assume that if their income is the same, they didn't move, they didn't have another child, they have roughly the same income, if nothing significant has changed this last year for them, they assume, well, my subsidy will probably be about the same as well. And then and it doesn't help that when your insurance carrier sends you the renewal notice, they don't know what your subsidy is going to be, so they base it off of whatever it is the current year, and they say, well, based on your current information, estimate that you'll, your subsidy will, be whatever it is. Well, then it turns out, oh, a different carrier swooped in and undercut and stole the benchmark plan, and so now your subsidy may actually drop, even under the American Rescue Plan. For most, hearing, oh, the subsidies are generous this year for you. It went from, like, $800 a month down to $200 a month. So now your premiums just went up $600 for your family. And how did that happen? Because people, or as well. That's the other thing. Doctors retire. Hospitals buy out other hospitals. Things happen, and so all of a sudden your primary care physician maybe is no longer a network, or that sort of thing. So I always tell people, actively and you may end up renewing your same plan anyway, but just don't do it blindly. And
right.
That's one of the reasons why.
Right. Well, and these numbers are kind of inclusive. So hopefully people are being educated in what they get. Hopefully they're getting the coverage they need. It's encouraging to me, at least, to see the numbers continue to grow. I'm always watching the FFM versus the SBM, because there's a lot of different technical pieces and policy pieces that come into play with that. But I've been very encouraged by seeing these numbers. Thank you so much for coming and chatting with us again. I love that we had our little pre-OE conversation and our almost post-OE conversation. And hopefully you'll come back yet again, because we love having you. We love talking to you, and getting the wonks together always makes me happy.
Sure. No, thanks. Thank you for having me again. And it's always a pleasure.
Great. Maybe you'll log into LinkedIn just to connect with me.
I will do so as soon as we're done with this.
Wonderful. Thank you guys so much. Have a great afternoon.
Yeah, you too. Thank you.
Bye-bye.